Hello and welcome to episode 3 of VetPhysioLife, brought to you by the Ralph Mobile Physiotherapy and Rehabilitation Service. My name is Shailen Jasani and I'm joined once again by Kim Sheeder, our lead physiotherapist. Hi Kim.
Hello.
How are you?
I'm good, thank you very much.
Excellent. So Kim, I thought what we would do was catch up a little bit about the cases that you've seen over the last couple of days, if you don't mind.
Yeah. So I saw a few yesterday. So I saw a conservative management of intervertebral disc disease. So a little 14-year-old Coton du Tulear who has got 2 or 3 disc bulges, but they were decided that although they might have been operable, that they could have surgery to have them removed because there was one at the higher level of the spine and one at the lower level of the spine that it would have been a bit too much to operate on. So we were going to have a try at managing conservatively without surgery, and he's actually done brilliantly, this little dog, and he's now pretty much back to normal, and I just see him to make sure he stays that way, really. Keep him as loose as possible, and as he's 14, sort of keep him going as much as possible. So he's doing really well, so that was nice.
Kim, before we move on, what was his breed again?
He's a Coton du Tulear, so he's sort of slightly less curly. It's a slightly less curly Bichon Frise, a small sort of white, curly, long-haired dog. Very, very cute. He's a lovely little dog, very sweet personality.
Okay, fantastic. Yeah. That's totally my ignorance, but I will definitely go look at some pictures after this call. They're not a very common breed, so no, I think you're allowed to be a bit ignorant. That's fine. Okay, fair enough. All right, carry on.
And then who else did I see? So then I saw another 14-year-old, a chocolate lab, who many moons ago had an elbow replacement. And he's just got lots of arthritis. So he's got some arthritis up in the front end obviously that was why he had the elbow replacement in the first place. And the other side, the leg on the other side is struggling a bit because it's had to compensate for the joint replacement on the operated side. And then he's also got lumbosacral disease. So that's just the joint at the bottom of the spine where it meets the pelvis. That can get arthritis as well, and that can cause back leg problems. So he has hydro once a week, and then I see him once or twice a week to try and keep him as limber and as comfortable as possible. So I do lots of soft tissue massage and lots of manual techniques with him to keep him as loose as possible. I also sometimes use some laser with him if I think he's feeling particularly sore, and I'll also use pulse electromagnetic field with him sometimes because that can be quite good for arthritis pain.
So he's having like the full arsenal, basically.
He's having everything. He's having everything, bless him. But he's such a lovely boy.
Kim, are you engaged in terms of the hydro that he has, or is that out of your...
He was already having hydro before I started seeing him, so I didn't have a massive amount to do with it, but I have liaised with the hydrotherapist in the past, and sort of had discussions about what they're thinking and what I'm thinking, and we've basically been on the same page, so it works quite well. Because he's got so many joint problems, it's a bit more difficult for him to do land-based exercises. So the hydrotherapy aims to keep him as strong as possible, while the land-based physio aims to keep him as comfortable as possible, basically.
Yeah, fantastic. And I know that you're always keen to stress that, as far as you're concerned, hydrotherapy is one tool in your toolkit.
Very much so.
Rather than people seeing hydrotherapy as something separate to physiotherapy and you can do one or the other, or, they don't communicate.
Yeah, absolutely. Absolutely. You wouldn't get, there's no such thing as a human hydrotherapist. If you had hydrotherapy as a human, you're going to be given hydrotherapy by a physiotherapist. So yeah, I think it's very important that we either work very closely with the hydrotherapist or the physios do the hydrotherapy, either or. Yeah.
Cool, very cool. Okay, I'll let you carry on with your next case.
Then I treated a little pug who has got a couple of problems. So they're recovering from a hemilaminectomy, which is the surgery that you have for a disc bulge or a slip disc in layman's terms. And she's doing all right, but she's got an added problem in that something that a few pugs can have. She's got syringomyelia as well, so she's got pockets of fluid in her spinal cord that shouldn't be there, that cause her neurological problems. So although she's generally getting better, she'll have sort of peaks and troughs where she might get a bump or might sort of play too vigorously with the other pug that she lives with, and then she can go a bit more wobbly probably because of the syringomyelia affecting her as well. So did some rehab with her and continued her exercises, trying to build her cardiovascular fitness as well, because she's a little pug and she likes to sit around and not do much, so we need to keep her going.
And how old is she?
Off the top of my head, I can't remember exactly, but she's about 8 or 9.
Okay.
She's not too old.
and what cardiovascular type exercise would you do with a dog like her?
So with her, I do interval training. So I take her to the park, which I'm very lucky is directly across the road from where she lives, in central London. So there's obviously, they don't have a big garden, but we can get to the park, which is brilliant. And then we do short sprints to try and get her heart racing, do some actual cardiovascular fitness, because it's quite difficult with a pug. You've got to give them the ability to recover, because they can have problems with their breathing because they're such a short-nosed breed. So I find that sort of short little sprints, which we know within the human field and the sports research field, can be very, very effective, if not more effective, for increasing cardiovascular fitness than just endurance. So going on and on, running and running. So yeah, we do little interval training, little sort of 20-second sprints, and then 30 seconds rest, and then 20 seconds sprint, and then 30 seconds rest. Thankfully, she's very food orientated, so she'll run after any treat as long as I've got one.
I really have to see a video of this sometime. Bless her. Amazing.
Yeah.
And was there anyone else that you got to see in the last couple of days?
Yeah, Whippet, who is 12, who had fibrocartilaginous embolism. Always have problems saying that. Yeah. An FCE for short. But she had that about 3 or 4 years ago now, and I treated her when she initially presented with the FCE, and she had quite severely affected on just her left hind leg. You frequently find with FCEs that one leg is more affected than all the rest. And she actually recovered very well. She's still got a bit of a limp. You can still tell which side is the problem, but she can run, she can sprint, she can trot, she can be a bit of a bonkers whippet when she wants to. But I've just started seeing her regularly again in the last sort of 6 months or so, as she's just got a bit older, and her carers have noticed that she's just started stiffening up a bit. So I do manual release on her lower back, and lots of soft tissue stuff on her front legs, especially because of the back leg problem, she's pitched her weight forwards a bit too much, and she tends to use her front end a little bit too much. So we try and ease off her secondary discomforts because of that. And then we've got her doing some strengthening exercises as well to try and persuade her that she does want to put weight on that back end again, try and build her bum up a bit.
Wow, that's fantastic. So there's like a whole there's so many things in there that I'd like to ask you, but I don't want to keep you for too long. The one thing I did want to just touch on briefly was the disc stuff, because obviously a couple of the patients that you've seen have got that problem. And would you mind just explaining to people just a little bit, like briefly, what that's all about? What do we mean by a disc bulging, and what is the problem with it?